Today's lesson will be on IV initiation. The objectives for this lesson will include setting up the IV bag, initiating the IV, and discontinuing the IV. Before getting started, you should first ensure that you have all of your required equipment to start the IV. This equipment should include the appropriate IV solution, an administration set, an IV catheter, an op site, some sterile gauze, some alcohol swabs, micropore tape, a tourniquet, and of course a pair of gloves. Now that you have all of your equipment ready, you will need to prep your IV line. First, rip open the protective covering of the IV solution. While doing this, ensure that you have considered the 6 rights of medication administration, which include right patient, right time, right drug, right route, right dose, and right documentation. Also, you will want to inspect the IV solution for cloudiness in the fluid, leaks in the bag, precipitates in the solution, and ensure that the expiry date has not passed. Now you can hang your IV solution on an IV pole, which may be located on your stretcher. If an IV pole is not available, you may require a bystander to hold the bag for you. In either case, you must ensure that the bag is at least 3 feet above the insertion site. Next, make sure that you have selected the appropriate administration set and open up the packaging. Remove the protective cap on the IV bag, as well as the spike of the administration set. Now take the spike and insert it into the port on the IV bag using a slight twisting motion. Once the line is attached to the IV bag, squeeze the drip chamber until it is 1/2 to 2/3 full of solution. Now slide the roller clamp all the way to the top to allow the IV solution to run freely through the line. The purpose of this is to allow all the air to be flushed out of the line to prevent an air embolism. Once the line is flushed, slide the roller clamp all the way to the bottom. Your IV line is now prepped and ready to be used for your patient. Now that your IV bag is prepared, we are now ready to start an IV on our patient. First, apply a tourniquet across the long bone of the limb you will be starting the IV on. Ensure that the tourniquet is tight enough to impede venous flow, but not cut off arterial flow. You will also want to make sure that the tourniquet has a quick release feature. In order to help distend the patient's vein, you can ask them to squeeze their hand open and close several times. You can lightly tap over the vein. You can use an alcohol swab to rub over their vein, or you can apply hot packs to the patient's limb to help promote blood flow to the area. Once you have selected your vein, clean the site using an alcohol swab. Use a circular motion to clean the site so that you are pushing dirt away from the injection site. Allow the alcohol to dry completely. This may take up to 60 seconds. While waiting for the alcohol to dry, select your appropriately sized IV catheter. A smaller sized catheter could be used for medication administration, while a larger sized catheter could be used for fluid replacement. But remember, in the end, the size of the patient's vein will be the ultimate deciding factor on catheter size selection. Now, holding the IV in one hand with your thumb and middle finger, use your other hand to apply traction to the patient's skin distal to the insertion site. This traction will help prevent the patient's vein from rolling upon insertion. Insert the IV at a 45-degree angle until you see flash in the flash chamber. Then drop the IV down an angle and insert the entire needle 1 to 2 millimeters more into the vein. Next, using your index finger, slide the catheter off the needle and into the vein until the catheter hub is up against the patient's skin. Now slide the needle out of the catheter until you hear the needle click. Then remove the tourniquet from the patient's arm. Next, apply your op site over the insertion site 3/4 of the way up the catheter hub. This helps to hold the catheter in place while you attach the IV line and prevents the catheter from accidentally being pulled out. Now, place a single piece of gauze under the end of the catheter while you attach the IV line to catch any drop of blood that may come out. Now, occlude the vein proximal to the injection site and remove the needle. The needle should be placed in a sharps container for safety. Next, screw on your IV line to the catheter hub to secure in place. Now that your IV line is attached to the patient, slide the roller clamp all the way to the top to ensure the IV placement has not gone interstitial. Finally, tape down the IV line so it cannot be easily pulled out and set your appropriate flow rate using the roller clamp. When the patient no longer requires an IV, or if IV complication arise, it may be appropriate to discontinue an IV. First, remove all of the tape that is holding the line down. Next, remove the op site. Start at the outer edges of the op site and work your way towards the insertion site. Finally, apply a piece of gauze over the insertion site and using a quick fluid motion, pull the IV out in the opposite direction to which it was inserted. To help minimize bruising, apply pressure over the insertion site for several minutes. We have now come full circle. We have learned how to set up our IV equipment, how to insert an IV, and how to discontinue an IV. Thank you for participating in today's lesson, and I hope you feel more prepared to start your own IV on a patient. Good luck!